All right. So another aspect, still talking about the ethical practices in gynecology, we are looking at consent for sterilization. Consent for sterilization in gynecology. So this consent for sterilization is more of like, okay, somebody doesn't want to give birth again. So as a person doesn't want to give birth again, you know, you want to sterilize the person, right? But you carefully still explain the whole issue to the person, so that the person willfully agrees. So consent for sterilization in gynecology is just a critical ethical and legal process. It ensures that a patient voluntarily agrees to undergo a permanent contraceptive procedure. So permanently, it could be that they are tying up the fallopian tube, it could be that they are cutting off the fallopian tube and all of that. So these are sensitive areas. Patient must actually 100% agree to this. Alright. So typically you're talking about tubal ligation after receiving full and understandable information. So because sterilization is irreversible, so you don't want issues coming up. So the consent process must be especially thorough and respectful to the patient autonomy. So if the patient says yes, do it. They say no, you chill up. So disclosure, clear explanation of the procedure, risks, benefits, and alternatives. Understanding, ensuring that the patient comprehends the information that was provided. Voluntariness, consent must be given freely without coercion or undue influence. Competence, patient must be mentally capable of making the decision. So you don't give this kind of inquiry to patients that maybe are not mentally stable at that time or so. So key information to discuss is nature and permanence of sterilization. You make the patient know that once they do this thing, you can't give birth again. You understand? Alternative contraception. So you tell them about all the other types of temporal contraception. So they must actually choose this permanent one over the temporal ones before you do it. You tell them about the risks, surgical risks, possibility of failure, impact on future fertility and all of that. Okay, so you are doing all of this because you are doing all of this just to avoid all those lawsuits that might come up, because gynecology is a field that is actually filled up with lawsuits a lot, for real. Okay, so that's it for this one.